us. Anyhow, I'm really pleased tonight, guys, to be able to introduce Einat Danieli. She's here from the North York Neighbourhood Care Team to talk about a couple of things. First of all, changes in the way healthcare is going to be delivered in the province, and there's some interesting developments along that line, and I think everybody, of course, is interested in how healthcare impacts our everyday lives. So, I'll give you that. Sorry. And then she's also going to talk about the North York Neighbourhood Care Team and what they do, and some opportunities maybe for our building to bring some services into the building. So this is a really exciting opportunity for us, and we'll see where it takes us. Now, the other thing that I'd like to mention is that we are recording this. Barry set up to recording that. So we will record the first part of the presentation, but we won't be recording any of the questions in Q&A, just for privacy reasons. This will be posted on our Facebook page and probably our YouTube channel. So if you've got friends that weren't able to make it tonight, we will get the information out to them. So I think I mentioned all that stuff.
You did. Thank you so much, Jerry.
Anyhow, without any further ado, I'll turn it over to Einat.
Thank you so much. Thank you so much for all your help and bringing me here and for setting this up. And thank you everybody for deciding to spend your evening with us today. We're so excited about the attendance, and we're so excited to meet you. So I wanted to also just extend an introduction to two of my colleagues that are with me today. There are many more, but they were able to join us today. So maybe introduce yourselves very quickly.
So hi everyone, this is Ricky. So I'm the Director of Home Support Services. Actually, we have assisted living service at Seneca Tower. So that is more near to the 401 highway. Yeah. So we are here to support the whole team, and then whenever there is anything we can help, we can offer that. Especially when we are doing the translations or the other expertise that we can help. And she's my colleague, so she's Gloria. So she's our interim program manager. So we are here as a team to support the whole.
And thank you for being with us tonight. I hope that over time you'll get introduced to more and more of our partners. So today I'm going to talk to you about a new model of care. But as Jerry said, before I go into that model of care, I'll be talking about some changes, major changes that are happening in our healthcare system in Ontario. Some of you may know about them or have heard about them in the news, and some of you might be completely new to this. But I think it's important to understand, because that will kind of help you make the link to why we are building our model of care the way we are and what we're trying to do. So, as Jerry said, I'm Einat. I'm a clinical manager. I'm an occupational therapist by background, and I work for Baycrest Hospital. But really today I'm wearing the hat of many different organizations that are coming together to work as one team under this model of care called the Neighbourhood Care Team. So I want to start, and because of the recording, we will hold questions to the end of the presentation. So I do apologize in advance if it's going to be a lot of information coming at you, but all at once. But hopefully you have something, or you could remember your questions and take notes. And I hope to address all your questions at the end of this presentation. So what do I want to tell you today? So let's start with healthcare transformation. Our Ministry of Health have announced in 2019 the People's Act. And the intention of that act, even though somewhat delayed a little bit by the COVID pandemic, was to build a better and more connected healthcare system that is centered around people like yourselves, patients and families and caregivers. And these changes are meant to really strengthen our system, to strengthen and make it easier for people like yourselves and the general population to navigate the system and get the care that you need. And I think we know, or you may have already experienced firsthand, some of the challenges that we have with our system, and mostly because of some fragmentation that we have within the system, where you get certain aspects of the care from one entity and then another aspect of the care from another, but they don't always connect well together or communicate with each other. Different legislations, different funding models, all of that. So what the government is trying to do is to bring all of that together, and within that act they announced the formation of Ontario Health Teams. Have you heard that term before? Just kind of give me a nod. Some yes, some no. And so Ontario Health Teams are meant to be a group of providers and organizations that at maturity will be fiscally and clinically responsible together to and accountable for delivering the full coordinated continuum of care to a specific population. So in your case, that population will be, let's say, the population of the building. And I'll dive into that and explain what that means, why that's different than what we're doing right now. So bear with me just a little bit longer. So if before you had your primary care provider, but then you had your specialist at the hospital, and then you had your community provider maybe helping with some things around the house, or if you're coming out of hospital, you have community or home, Ontario Health at Home providers that would come to your home, and each of those would be different entities. The idea is to have all of those organizations and all of those services work with you and your family as one team. So across Ontario, there has been 58 approved OHTs, Ontario Health Teams, that are slowly forming. And these are not small shifts. It's not something that we've announced in 2019, and here we are, embarking on this new road, because these are really major changes in legal structures, funding structures, organizational structures that will unfold over time. But at maturity, what you will start seeing on the ground, because we're starting to live that vision on the ground, is move and shift from what we know as transaction-based metrics, meaning that me as a clinician, I had to report up until now, how many people did I see and how many services did I provide. We're shifting away from that to value-based care. Now, value-based care shifts our focus, instead of those kind of deliverables, into what is the actual impact that we provided on the health of the population that we care for. And was the service that we provided or that impact meaningful to them relative to the cost of achieving those outcomes? So 3 components in that mouthful sentence. One is looking at health outcomes, not just how many services or appointments I provided, or not at all about how many appointments I provided. Matters to patients, so really zooming in on being more driven by our community and by our population to provide you care that is meaningful for you. I could think it's great, but if it's not meaningful for you, you're not going to engage in it, and it's not going to really increase your quality of life or health. And the third thing is, of course, efficiency measures, to also make sure that we remain efficient in the way that we deliver care after we've achieved those 2 other goals. So what you will see from your perspective as a patient in our system, or a client, I would say, in our system, what you will see is, instead of that fragmented approach, slowly you'll see the system forming into one team for both your health and social needs. Very likely, and what we anticipate and are seeing the system going towards, it will be wrapped around your primary care provider, and I'll talk about the changes in primary care in a moment as well. But you'll probably see this coming out of your family doctor's office, in your primary care team or health team, and with tentacles into where you live and in your local community. The other thing you'll see is bringing healthcare into the community. You'll see clinical services coming out of the traditional environment of healthcare or the hospital and more into the community. And focus on local needs, culturally informed care. So really working together with the community and co-designing with the community the care that is meaningful and suitable to you, that works for you. So really looking at what matters to you as a patient or a client in the system. The other major shift, and they seem separate but they are intertwined and connected, is the primary care action team. And that's a new vision in primary care, the delivery of primary care that is unfolding right now in our system, and it's a big investment of $1.8 billion on the establishment of 300 new primary care teams across our province to attach every person in Ontario to a primary care provider. This very much is led by the vision and actually led by Dr. Jane Philpott, who is formerly a family physician. She was also a Physicians Without Border, and later on went into politics to really change healthcare from the top, and pushed a lot of very important policies to benefit many different us as individuals and consumers. And you could see on the screen the book that she wrote. Jane Philpott wrote the book Health for All, and that book could give you a very good insight into the vision that she's trying to roll out in our province for primary care. So that vision is about team-based primary care that is local, for each person to have access, almost like our children have access to a school. When they come to a postal code, they have a designated school. What Jane wants is that no matter where you live, you will always have access to a local primary care physician and team, or provider and team, that can tend to your needs. And some of that vision is also, some of the objectives is also to give you better access into your medical record, so that you will have a portal where you can see your information, you could see who is the team that you're involved with, and follow and manage your health. So, just to say a few more things about that before I move to how the neighborhood care team model connects into that. Some of the objectives or the principles that are coming out of this primary care vision is the knowledge or understanding that primary care is a very important foundation in our public funded healthcare system. And we also know that good primary care does bring better health outcomes. And so we would like to create a system that primary care is your good, reliable, accessible first point of contact when you're seeking healthcare. And that it's consistent. It's not about, it's not changing on you all the time, that you have this team and a primary care provider that knows you, that is there for the long run, that has your record, and that have been there for years as you progress with your healthcare needs. And it's also about the understanding that team-based primary care does increase our system capacity to support individuals in getting better health outcomes, and capacity as a whole to address complex medical issues or healthcare issues. And it does result in better satisfaction. We know that if I come to a physician and they don't really have the time to spend with me, or I have to bring only one issue at a time, but I have a complexity of issues, it's not addressed, it's not a good experience for me because I have to come multiple times, or I don't feel that I really got the full attention that I needed to address all my needs. And it's not a good experience for the provider as well, because they really are there to help. That's why they went on this path to begin with. And so this really is meant to create that system that will allow our providers to work together and to provide better care and for you to have a better experience. So what is the neighborhood care team, and what is that has to do with all those major changes that I've just mentioned to you? The North York Neighborhood Care Team, I would say, is a little bit of a micro illustration of what we would like that system to look like. So the North York Neighborhood Care Team is a partnership of multiple organizations. You could see some of them on the screen, but for those who cannot see that, I'm just going to read them out. So I'm from Baycrest, but Unison Health Community Services, VHA Home Healthcare, Circle of Care from Sinai Health, Ontario Health at Home, North York Senior Center, Bayshore Healthcare, E-Hong, SRT MedStaff, LumaCare, and Toronto Paramedic Services are some of the partners that are already engaged, and we continue to seek more partners based on the needs of the population that we discover or that we engage with to bring to our group and collaborate with us. So our group, the Neighborhood Care Team, is partnership of those organizations that are working together as one team to provide coordinated and accessible services to a certain population, community members. And we do that by collaborating with building management and the community members that live within a building. And we support those communities in staying healthy, connected to services, and engaged with their primary care and other essential services. So that means that if you don't have a primary care provider, we will definitely make sure that we connect you to one. Or if your relationship are not working well, we'll try to figure out what are the barriers and help that work better for you. So here are some pictures and some examples of the activities that we provide. Again, I'll just read them out for clarity. We help with system navigation and connection to services. We provide a lot of health education to empower our community members and educate them about their health conditions so that they know how to stay healthy and better manage their health. We bring to all of our buildings every fall wellness and vaccination clinics. And those that some communities have highlighted for us that they have trouble with accessing fresh produce or accessing food. So we brought a farmers market that we host in their community, which is generally subsidized. So it's generally slightly cheaper than your regular grocery store and more convenient because it's right there in your building. Some buildings where there was difficulty in accessing dental, we brought a dental hygienist to the building, hearing screens, digital literacy. We talked about patients having a portal. So digital literacy will play a really important role in that. If you don't know how to access your portal or you're having trouble accessing your portal, wouldn't it be nice to have somebody that you could drop by at your building or call and say, could you help me access my portal and know how to use it? Food care, chronic disease management, and of course access to primary care. So the Neighborhood Care Team, to speak a little bit about how we're funded, and for transparency and also for your understanding on how this works. So I would say the Neighborhood Care Team is very much a coalition of the willing. Those organizations are contributing their time and operating within their different funding envelopes to direct their services to support the communities. And all of our partners are non-for-profit organizations that are funded by the Ontario Ministry of Health through Ontario Health. So very much our mission is to provide you services and to support your well-being. And a lot of our services will not incur any cost to the community. But of course, we have to follow our funding envelope. So everything that is outside eligibility criteria for funding, for funded service, or anything that is outside of OHIP funding might incur cost. And we're not for profit. So will, where we can and where people cannot pay for certain services, we will of course try to find you the way to subsidize or subsidize it ourselves. Where you do need to pay, we will not overcharge you in any way. We'll take the minimal that we need to cover our costs, because our mission is to deliver you a service, not to make a profit. So on the screen you see some examples of what are the services that are covered, and I'll give just maybe a few examples. So dental, some people have access through the government or Toronto Public Health and the city. There is provincial funding, there is federal funding. They have access to some dental coverage. Then we are able to cover them through that if they're eligible for that. And if they're not and they don't have any other coverage, we will need to charge to cover our costs. So that's just one example. The other example, which is similar, is food care. If somebody is low income, we will do our best to try and cover that service for them so that they don't have to incur the cost. And food care is an important service, and it's an important component of care. And where they can pay, then of course we will charge, but the minimum that we need to cover our costs. Let's talk about some of the impact. This model is newish, but it's not coming out of midair. We've already implemented it in about 8 buildings, and we are already starting to see some of the impact on the ground on our communities and their health. We're definitely seeing some reduction in emergency department visits and readmission rate. 99.4% of the community members that participate in this neighborhood care team model reported that it improved their ability to better manage their health. Now, there are some conditions that we cannot improve because of the nature of the condition, but we could still improve quality of life, and we could empower someone to better manage it so that they can have a better quality of life. And some conditions can be improved significantly, even prevented, if we could engage the community in staying healthy and impact lifestyle choices and catch things early. And you can see on the screen some of the things that people said. Easy access and familiar faces, because the team is consistent, it's here. People get to know us over time and trust us. And some people said it's very important services that are in my building. I don't have to look for them, I don't have to find my way. I just tap someone on the shoulder and they make the connections for me. And the benefits to community members is easy local access to the care that they need, trusted team to support navigation and connection to services, proactive and early identification of needs. Our teams are very much trained. Even if you come and you say, I just need, I don't know, a vaccine today, or could you just tell me how I get this type of funding? They're trained to look at you holistically so that they'll know to offer you and screen you for things that you didn't even know to ask for. Not in an intrusive way. We respect people's autonomy and choices, but just to give you an awareness, because you don't know what you don't know, right? And of course, our approach is very preventative. So really, we are about promoting wellness, independence, and better quality of life. Some of the benefits for you as a community, beyond the individual, is that what we see does promote successful and stable tenancy over time. It increased resident and community member satisfaction in their community because they get access to services in their buildings. They have more quality of life. They can participate and engage more within their community. And having a contact that not only when you need something, but maybe you notice that your neighbor is in trouble, or maybe your neighbor challenges are impacting your quality of life. I'm not talking about general neighbor to neighbor issues. we can't do it all, but health related issues, if you know what I mean. And then you have a contact, you have somebody you could come and talk to about this that might be able to help. So what is our engagement process? How do we engage with our communities? So very much it starts with a presentation like that. And if a community expresses interest in engaging with this model, the first thing we do is we will survey the community on what, we'll do an anonymous survey with individuals from the community on what is your, what are your challenges or barriers right now with accessing the system? What kind of services or support would you like to see in your building to help you stay healthy? And then we present the results to the community members in an engagement. So we'll have maybe a dinner or lunch, depending on your community schedule, what works. I'm getting a feeling from this education, maybe this is an evening kind of community, but we'll have an event, we'll meet and we'll show you the results of your survey. We'll talk about some of our ideas and get some more input from you and direction and guidance and what should we do at this building and how should we introduce it to the building and how frequently, like what would work, what you don't want to see here, what is too much. Like we're very respectful of each community and what you think is a good fit for your building. And based on that engagement, we develop a plan and we start to gradually implement it. So and the way we implement it is also based on the feedback you give us. So if you told us that X is your first priority, but A is your lowest priority, we will attempt to try and do X first, implement X first. So we will go by your priority. Unless it's something that is really unusual for us, it's a new service that we need to resource and it's harder for us to come, but then we'll be transparent with you. We'll say, we would like to try and make this happen. We don't have it. We're going to resource and get back to you and see what we can do. We like to try if we can. And then we'll implement in that order. And we are very committed to continue and communicate with our community, to collect feedback, to engage, and to evaluate to make sure that we are meeting the targets and to your satisfaction. What we need to get started is very minimal. All we need is your management and board approval and collaboration. We need your buy-in as a community to say that you're interested in this, and some access to bookable space and agreed upon communication channels. We need you to tell us what is a good, effective, and acceptable communication channel to you, because we're not going to solicit you. We're not going to come knock on your door without permission to tell you to join services. We're going to be very respectful, and what you're going to tell us is the right way to communicate with you. And there will be room for individual choices. It might be like a standard approach. This is how we approach the community as a whole. But as we engage with you in services, you might tell us about your personal preferences. Some people really like email. Some people like us to call. Some people say, just knock on my door when you're here. You know, every person is a bit different, and we really go above and beyond to be respectful of that. So so I would like to pause the presentation at this point and end with this slide. And just say, I would like to hear your questions and comments to that. I'm very curious on what you have to say about what you've heard today. And I hope to hear from you if you're interested in this, in exploring this further. If you are interested in this, then the next steps for us would be the survey and community engagement. And if we make it early enough in the season, in the fall season, we might be even able to bring to your building in November a wellness and vaccination clinic to bring flu, COVID vaccines into your building. That clinic also includes vitals checks and some health navigation and some screening for health and social needs. So we might make it this season for that clinic, but no rush if that's not a good speed for your specific community. And the season is starting. That's the sound of the beginning of that season.
No, that's allergy.
But it was just right on point. So, and then if all of that works well, then we'll do a gradual implementation at the pace that you're comfortable with. So with that, I want to end, and I'm very curious. You've been very patient in listening to me talk and through a lot of information and details. I would love to hear from you now, and we'll stop the recording so that you could ask freely without wondering about